a lot to tell, and we'll appreciate that. It is now my humble pleasure to welcome our chief guest to give an oversight as we progress. We still have more time, and that is our Deputy President, Karibu Sana. Please, let's be upstanding.
No, we don't have to stand. You don't have to stand, please. Why are you harassing people? We were all doing fine until you brought the standing up thing. So, listening to the people who have already spoken, we are actually having a conversation of our lifetime. I think David may have underestimated what he said earlier about the importance of this conversation. I see the passion in everybody and in what they are saying. And it goes to confirm that this is one conversation that is a must-have. And this is one subject that must be will be a must-do. Listening so far, and I'm going to give way to another 3 or so presenters. As I said earlier, and now it has been confirmed by what the speakers have said, is we finally must get it right at the dispensary. We must get it right at the health center. And we must get it right at the bottom of the pyramid. The crisis we have today in our referral facilities is because there is a shortage of health professionals at the dispensary. There is no drugs at the dispensary. And it will cost us less. It will make it that much more accessible if we made it available at the bottom of the pyramid. And that seems to be what you as professionals are telling us. The second item that I am picking from here is a health management system, an electronic, so to speak, health records system, so that we avoid the duplication that is going on. You go to a facility, go to MRI. You go to the next facility, go to MRI. You go to a hospital here, go and take these samples. We can reduce significantly the cost of deploying our health by making sure that health records are available. We just need a mechanism, and it is not rocket science because it's done by other countries, of making sure that there is health records confidentiality. Outside that, there is absolutely no reason why we must not have electronic health records that are portable, that when you go to a health facility in Korogosho, and tomorrow you go, or next week or next month, you feel sick and you go to a health facility in Nakuru, the doctor or the health professional in Nakuru should know what you are diagnosed with, the kind of treatment you were given, and then begin from there to figure out what can happen next. That way, we can bring down the cost of delivery of our health programs. And I want to promise you that this is one item that we must sort out. In fact, we had gone as a government a very long way in acquiring this health management system complete with health records. an electronic health records program, but because of conflict of interest and many other issues, it wasn't possible. This is one deliverable that will reduce significantly the cost of supply of our health services. Number two, or number three for that matter, we must have a competitive, transparent, stakeholder-driven procurement of all our health commodities. We just must do it. It's been done in the energy sector. We have some of the most competitive oil prices because of the nexus between the private sector and government in the procurement in that sector. We can deploy the same in the provision of our health commodities. I spoke to a doctor, and we are currently buying health fluids, the drips we have, and which is 95% water. So we are basically importing water from other countries, and we are paying for it. I think it's time we went down the road and make sure that we scale up our manufacturing locally. The reason why, and it must be deliberate, manufacturing locally of pharmaceutical commodities must be informed by our desire to create local jobs. And it must be possible for us to produce many of these facilities locally. I told you earlier, I don't know whether it's by coincidence, I was speaking to one gentleman yesterday who produces medical supplies, medical commodities. I will not mention which ones because I don't want them targeted. And he told me that he supplies everywhere else from Mombasa except to Kenya. He can supply his commodities, which are manufactured in Kenya, to all other facilities, including in far-flung areas, but he cannot simply access the Kenyan market. And that is a Kenyan producing in Kenya, but cannot access the Kenyan market. We must be, and that is primarily because of the cartel around KEMSA and the whole of that space. So we must break the cartel and make it possible for manufacturing of pharmaceutical commodities to happen in Kenya so that we can get quality, as has been asked here. We can control quality more, and we can control also accessibility more. These are among the items that so far I have picked. We're still sitting here, all of us, and the remainder of the speakers, we would like them to focus. We've heard from our health practitioners the need to balance the success that we have achieved in devolving health to the counties, and I like it that even health professionals themselves admit that there's been some success and progress made, and we now need to balance that so that there is no tension between the doctor and the patient. We need to harmonize, we need to create harmony so that the patient has access to healthcare, but also the doctor is working in an environment, or the health professional is working in an environment that does not undermine their own progress and does not undermine their own well-being. So that is, I think, the balance we need to create. And I agree that health being a matter that keeps evolving, continuous training, continuous progression is necessary, and there must be a mechanism. I am aware, sitting in IBEC, that many counties are grappling with a doctor who wants to go for further studies and requires a scholarship. And the county saying, we can't allow you to go train more because we don't have the money to hire somebody else to do what you have been doing. So this is the tensions we need to resolve, and I am hopeful that by the end of this conversation, and having listened from across the country, we will finally come to a fair balance that will give us the thrust to move healthcare to the next level. I also